Do you have ongoing fatigue and trying to figure out what could be going on that's causing your fatigue? Maybe you also have hypothyroid symptoms such as weight gain, dry skin, constipation. My name is Dr. Taranella. In this video, we're going to look at some of the overlooked thyroid hormone causes of fatigue. This is part of a broader series of videos on overlooked causes of fatigue, trying to help you understand some of the things that I look for and I see in my practice when people are struggling with fatigue, and sometimes these types of things are overlooked. So if you like this kind of information on health, hormones, nutrition, and just trying to grasp a better understanding of your health, click on the like button and don't forget to subscribe to get more videos like this one. Now for a quick disclaimer, the information contained in this video is for informational purposes only. It is not intended as a treatment for any health condition or as a substitute for seeing an actual doctor or medical professional. It should be used as an educational guide to deepen your understanding of health and treatment success. If you need medical attention, don't delay in seeking that treatment. All right, let's look at some of the overlooked thyroid hormone causes of fatigue. Low thyroid hormone production and hypothyroid are fairly straightforward things that happen in our body and fairly straightforward to diagnose and treat. But there are a few situations around hypothyroidism or insufficient thyroid hormone production that can be overlooked. And, it's not too unusual to find these scenarios in my practice. So before we get into that, just want to orient you to some terminology. So TSH is a hormone that's produced from your brain, and it causes your thyroid hormone to produce T4 and a little bit of T3. These are the thyroid hormones. The T4 is then converted into T3 in the tissues when it's needed. So one of the overlooked thyroid issues that can often lead to ongoing fatigue that goes underdiagnosed is the poor conversion between the T4 and the T3. The enzyme that does this is called a deiodinase. And there are some things that can influence those enzymes and how they actually perform their function. One of the things that can influence this is cortisol and the overall stress response. If you're under higher stress levels and you're producing higher cortisol, typically what happens is those deiodinases don't work properly and you end up with more conversion of that T4 into reverse T3. That reverse T3 can't actually be used. Now, it's normal for your body to make some reverse T3, but when that reverse T3 is on the high side or high normal side, that does suggest that there's poor conversion of T4 into T3, and you can actually measure the T3 level as well, and that gives you an idea of where the balance of your thyroid hormone is going. If a lot of it's going into that reverse T3, that means less is going to be available for T3. As a result of that, your tissues are getting less stimulation because the T3 is the active form of the thyroid hormone. Now, in these situations, you may have a normal T4 and a normal TSH, meaning within the normal reference range, but that free T3 or T3 overall is going to be on the low side or low normal. In this case, you may still have very much hypothyroid-like symptoms because your body cannot make that T3. Figuring out and diagnosing this is just a matter of looking at symptoms and doing the proper testing. Now, another overlooked thyroid hormone cause of fatigue, or another overlooked cause of fatigue, is when you actually have a normal TSH but low T4. In some cases, your brain and the hypothalamus and the pituitary gland are not responding properly to low T4 levels, and as a result, it's not functioning properly. So the brain is supposed to get the signal to produce more TSH when there's a lack of T4, but in some cases it doesn't do this. So while your thyroid gland is not making enough of the T4, your brain is not also triggering it or stimulating it to make more T4. So there's a mismatch there between the amount of thyroid hormone output, and the amount that your brain should be asking for. As a result, you may be more fatigued from that. Now, a lot of times in those cases, it's a deeper overall lack of stimulation and dysfunction within the hypothalamic pituitary axis. So those are some of the overlooked thyroid hormone causes of fatigue. I do see these in my practice from time to time. It's also common to see just, overall subclinical hypothyroidism, where people do respond favorably to treatment with thyroid hormone. Now, in cases where you don't have overt hypothyroidism or frank hypothyroidism, sometimes treating with thyroid hormone is not going to be very beneficial for you. So you do have to do some trial and error and see whether or not it's benefiting you. in any way. If it's not really helping your fatigue, it may not be worth continuing that kind of treatment. Okay, that should give you a better understanding of some of the overlooked thyroid hormone causes of fatigue. If you have any other questions about the content of this video, please drop it in the comment section. I may do a separate video on that. I'll definitely try and answer your question. Thank you again for watching. We'll see you next time.